Great. Thank you, Liza. Good morning, everyone. So our topic this morning is interprofessional education, and how do we move the content and the competencies that we discussed yesterday from the classroom into a clinical experience. And as I was reflecting on this, I was really appreciating that this poses unique challenges at every learning stage throughout the course of a clinical career. And I was reflecting on my own personal experiences with this. We all see this through our own lens. And I was thinking about my own transition from student to clinician. And I remember feeling two distinct feelings. One was being very, very nervous, which I'm sure most of you could appreciate. And I also remember feeling very alone. And I think it was this sense of the magnitude of responsibility that a complete stranger in treatment room number 6 was placing their health and well-being in my very rookie hands. And that was a really unnerving feeling for me. And I often wonder if I had had more exposure to interprofessional education, if I had really understood the depth and the breadth of experience and expertise of the clinical care team who surrounds every patient out there, if I had better understood what my role was and what my unique expertise was that I was bringing to that patient's care team, maybe I would have felt more confident and done a more competent job as an early career practitioner. So that was one thing I was reflecting on. The second was looking at some of my more recent work, helping to create multidisciplinary care teams, especially relative to spine care management. And there's often this really great moment as you're coaching a team through the phases of forming and storming and norming and finally performing as a group, especially a multidisciplinary care group. And I often hear providers saying things like, this has been a really stimulating experience, or this has really stretched what I thought I knew and helped me grow in practice. And I think importantly, I often hear things like, this has really made practice fun again. And this was mentioned just very briefly yesterday, but I wanted to bring it back to our discussion today. I wonder if interprofessional education and multidisciplinary care teams might be one of many strategies to help us address physician burnout and help increase satisfaction of providers over the course of their career in healthcare. So those are just two of the things that I've been musing on in preparation for this session. And with that, I'll turn the microphone over to Judy.